Well, welcome to another Children's Hospital of Richmond Facebook Live session. Today we're going to be following up from a statement that recently came out from the American Academy of Pediatrics that talks about the role of weight loss surgery in caring for adolescents with severe obesity. I'm Dr. Trey Wickham. I'm one of the associate professors here at Children's Hospital of Richmond and a co-director of the Healthy Lifestyle Center. And here today with me is Dr. David Lanning, who's professor of surgery and pediatrics and also the co-chief for surgery at Children's Hospital of Richmond. Both Dr. Lanning and I work together at the Healthy Lifestyle Center and are part of the comprehensive treatment team here. And part of the services that we do offer for children with the most severe forms of obesity is adolescent weight loss surgery. So in our Facebook Live session today, we were going to share more about kind of what weight loss surgery is and how to consider it in teens with severe obesity. So as folks have questions, feel free to leave questions and we'll try to get back responses to you within the week based on the topic that we have today for our Facebook Live session. So we'll go ahead and get started. David, what does adolescent weight loss surgery entail?
Well, certainly this operation itself is an operation on the stomach that really not only helps patients feel satisfied with smaller amounts that they eat, they're not hungry all the time, but there are a lot of metabolic benefits, basically a lot of hormonal and neurologic changes that really help patients lose significant weight. Now, certainly bariatric surgery in itself is not just done in a separate sort of silo. We are, as you know, part of a comprehensive team that has providers that look at all aspects of obesity, ranging from endocrine and medicine to psychology, exercise, and nutritional folks that really treat all aspects of obesity.
Yeah, and so it's been interesting. You know, one of the things I know just over the time that you and I have been doing this is really, as opposed to calling it weight loss surgery, a lot of folks are calling it metabolic surgery and bariatric surgery because of some of those things that you reference.
Some people think that it makes people so they can't eat well or that they're hungry all the time, but in fact that's really not the case. Patients, it does help them control their hunger. They feel satisfied with a smaller portion. But also a multitude of other benefits that really help with all those medical problems associated with obesity, such as hypertension and diabetes.
Mm. And how did we start to get to the point of actually talking about using this in adolescents, and even to the point the American Academy of Pediatrics, you know, one of the major policymakers for pediatric healthcare, has said, hey, for the right patient, this might be an important part of their care.
Right. Great question. You know, obviously over the last decade plus, we've had a really significant problem with obese adolescent patients. And there's some evidence to suggest, well, in some age groups, it's getting a bit better, but those that are severely obese, it's a significant problem, and the percentage continues to climb. Unfortunately, standard non-surgical means such as just healthy lifestyle modification in patients that are really severely obese traditionally don't work very well, and patients unfortunately have a really hard time getting to healthy weight and staying that way. So what has been demonstrated over time is that when weight loss surgery or metabolic bariatric surgery is combined with a multidisciplinary program, patients can be successful. Fortunately, we have lots of literature now that is coming out demonstrating in adolescent patients that at 5 years, they lose a significant amount of weight, but also, again, all those medical problems really are improved, if not resolved, with the operation, which has been a really exciting part. And also, more importantly, it's been demonstrated to be exceptionally safe. So now you have articles in the New England Journal of Medicine, and also with, as you mentioned, the AAP coming out, American Academy of Pediatrics coming out with a strong policy statement, really saying and endorsing that this should be considered for patients that meet criteria. And care should be as part of a multidisciplinary program such as ours.
Well, one of the things I always think, sort of talking to patients that they're surprised to hear is that actually the risk of having weight loss surgery, if you're having it done, you know, in a center with an experienced surgeon, is actually less than having your gallbladder taken out electively. And I think that really surprises folks. But when we think about, we've talked some about the health benefits, but what are some of the concerns that you would need to think about with weight loss surgery?
Well, certainly, being part of a multidisciplinary program, we do make sure that patients do take adequate amount of protein after the operation. They do take vitamins and minerals afterwards because there can be some nutritional deficiencies. Concerns in the past about patients not being able to reach their full height potential and so forth have come to demonstrate they're not founded, and really it is safe to move forward with metabolic bariatric surgery in adolescent patients. Even now, there's a lot of evidence to show that even patients that are in their preteens, if they made indications for surgery, really should have it.
Mm-hmm.
You mentioned about safety too. We have done a lot of things to really ensure the operation is done in a very safe way. We've implemented a number of principles too that not only make sure that the operation done is in a safe way, but in a timely manner, in a minimally invasive way. Most of our patients, as you know, will go home on post-op day 2. They're up walking around right away, back to school, and as early as a week. And again, with small little incisions, the pain is relatively manageable.
And I'm going to have you in just a second talk about kind of what families can kind of expect in the post-op period. And you said a little bit about that, but I might just kind of share with folks first kind of what leads up to surgery. So, I mean, I think you highlighted already that, you know, weight loss surgery, whether we're talking about in a teen or an adult, really isn't in isolation. It's part before surgery in conjunction with a comprehensive lifestyle modification program as well as after surgery. But most of the time our patients have been working with us for 6 or more months before we kind of decide that necessarily surgery is the right fit. And that's after extensive education from your team, as well as kind of meeting with our psychologist and having kind of formal evaluation, just to make sure that parents feel good about the decision and the teens feel good about the decision.
You're absolutely right. I mean, part of that multidisciplinary program that we have here is that we have experts in all those important areas, and we really try to help families and patients lose weight without surgery. That would be our number one choice, of course. But we know how difficult it can be, and we certainly have surgery as an option if it's deemed that would be best for the patient. But as you alluded to, we meet all the time. We talk about all the patients on a regular basis, give them the support they need in different areas, and then after 6 months, sometimes longer, sometimes we deem as a team that it's the best thing moving forward.
Mm-hmm. And and again, you highlight kind of the team, and one of the things, again, I think that AAP statement really highlights is that it is important that this is done, if you're going to think about weight loss surgery, it's done by a team that really has not just expertise in weight loss surgery, but specifically in adolescents. And I don't think I mentioned, as part of the thing, that the Healthy Lifestyle Center, we are accredited by the American College of Surgeons as a specific center of excellence for adolescent weight loss surgery, and are the only center that has such designation in the region, and includes a comprehensive care team of pediatric obesity medicine.
Right, for about 5 or so years now, we've been the only program.
So, I know a lot of times we'll hear questions about, why not wait till the patient's an adult, right? Like, waiting 5 years, till they can make a decision, and and because of the risk. What are your thoughts about that?
Great question. We see that all the time, and unfortunately, it results in significant worsening of all those medical problems associated with obesity, and sometimes patients that are really super heavy, and unfortunately, sometimes they're bullied or teased in school, and it affects their performance in school and so forth. So, as I alluded to earlier, there is great evidence now to demonstrate that you shouldn't wait until patients are older, because those comorbidities, those medical problems, just get worse and worse, and they don't lose their ability to reach their full height potential. And in fact, the success rate, is better with those younger patients. So if they meet criteria, then the policy now, the standard of care is to move forward with consideration.
So when you say the response rates are even better, and so can you share some stuff about just kind of the expected weight loss on average, but then also how do patients with, for example, teens with type 2 diabetes respond after surgery?
Great question. As far as total weight loss, you can expect that in adolescent patients with metabolic bariatric surgery, about a third or so of their extra weight a third of their total weight rather, comes off, similar to adults. but their resolution of their medical problems, such as diabetes, is actually quite better than adult patients. This has been demonstrated in New England Journal of Medicine articles. Recent article, as you know, this year has come out with 5-year data on adolescent patients. So once again, being the data that informs the AP such that they've made that really strong policy statement.
And that's the study, right, that showed that that youth with type 2 diabetes, you know, that had weight loss surgery, again, as part of this comprehensive care team, that they were more likely than adults to have experience remission of their diabetes.
That's right.
After
The majority of the patients were
after that.
No question.
So what specific criteria do we have for surgery now as kind of recommended as far as what youth might be appropriate?
Well, so the accepted really guidelines, indications are patients that have a BMI of 35 with some comorbidities, such as hypertension, fatty liver disease, or BMI 40. There has been a bit of a shift to looking at those that are 120% above the 95th percentile and above, again, with comorbidities are 140%. So again, that equates with about a BMI of 40. So as you know, unfortunately, a lot of our patients have BMIs of 50, 60, and so forth. And so we certainly are trying to encourage the providers in our community and families to consider this and just come in for the discussion. And again, meet with all the providers of our multidisciplinary team.
So there's more than, well, and I think that's an important point too, right, is that if folks are interested in hearing more about surgery, they don't have to have decided that it's the right fit for them before they come to see the team. They can just come get more information about really what would be the best kind of comprehensive care for them.
Yeah. To that point, we certainly by no means encourage or push families to surgery. In fact, as part of the verification guidelines, we don't consider surgery for 6 months, until non-surgical means for at least 6 months have been attempted. But we like to inform the families because they often have a lot of misunderstanding about what surgery is in terms of the type of operation, the pain involved, the risks involved. But at least inform them ahead of time so that they have an understanding, such that if in 6 months, that may be something that's considered. And also, it's really difficult with traditional healthy lifestyle modification to really lose weight. Your body, as you know, adapts and adjusts and wants to stay that way. And so sometimes people will lose hope. But at least knowing that there is a potential another option, such as surgery, keeps them engaged in the program. Because we really like to ensure that the families are engaged, the patients are engaged, they're following the recommendations, coming to appointments. Those are the ones we think will do best with surgery, if that's, we think that it comes to that, after 6 months.
And that's been a lot of where we've kind of seen, again, under a greater understanding of how surgery works. Again, how you kind of started off this conversation, that part of how it helps not only in the short term is by changing hormone and other things about metabolism that in the long run helps folks not only lose weight initially, but can help them keep it off in conjunction with ongoing sort of lifestyle changes. So there's more than one type of weight loss surgery. Do you want to share a little bit about kind of the types that are being used in adolescents and how they're different?
Sure. In fact, I do have some pictures that, I don't know if these can be seen, probably a bit too small, but one of the things that people do ask about, what about a gastric band? And certainly there was a lot of enthusiasm for a silicone band that was placed around the upper part of the stomach years ago. Unfortunately, the studies have demonstrated that most of those, or many of those, will need to be replaced, sometimes urgently, and thus really it's not FDA approved, and really most providers have shied away from placing bands in adults and adolescent patients. Gastric bypass certainly is an option that's been around for a long time and had lots of success. It does put patients at some risk for not only leak from where the anastomosis is, but some internal hernias. Many bariatric surgeons now shift towards what's called a vertical sleeve gastrectomy for adults, but certainly for adolescent patients. The vast majority of the expert centers like ours really have utilized that operation. It's a fantastic operation where it's really focusing on the stomach. There's no rerouting of the intestine. It does require or involve a removal of about 3/4 of the stomach. And it's called a sleeve sometimes because what's left of the stomach looks like the sleeve of someone's shirt or jacket. And not only does that, again, create a smaller reservoir for the stomach, such that patients feel satisfied with a smaller meal, but there are a lot of metabolic benefits, a lot of hormone changes, as I alluded to earlier, that really control patients' hunger and really does improve pretty much the entire spectrum of medical problems associated with obesity, hypertension, diabetes, alluded to, sleep apnea, fatty liver disease, and so forth. So it's done laparoscopically. As I mentioned, most patients go home really in a couple of days. They're up walking around right after the operation, and again, are back in school probably within a week, and can be back to most activities, around that time as well. We do slowly advance their diet over time and really ensure that they take the vitamins, minerals, and also protein as they're losing all that weight.
Can you tell us a little bit more about kind of the what happens as far as nutrition in that immediate period after surgery?
Well, certainly the body does shift, and it really does. A lot of that weight will come off. We want to make sure that patients are losing the fat, not the protein. So we really push the protein. We have a lot of protein shakes and drinks and so forth that we do rely on to keep that protein level up. And so that's certainly very important right after surgery, but even to some extent once they start back on a regular diet, that they have a small bit of protein with all their healthy meals.
And it takes about six weeks, right, to get back up to kind of that what's going to be their standard diet, and our team is working with them, kind of helping them know about kind of each of those stages.
Not only do all the providers, of course, including nutrition, see them before a lot, but afterwards as well, to make sure that they're on track and doing well.
Mm-hmm. And I know one of the things that we really highlight as a team that I think is important is that once an individual's had surgery, that it does require lifelong follow-up, making sure that they have kind of all of those nutritional needs met and things like that. And our team is well poised to sort of be able to help that.
We certainly, in an effort to try to, consolidate some of those appointments, because as I mentioned, a lot of these patients are traveling from all over the state because we're the only verified program in the state. We do try to, like I say, co-locate some of those visits together. We've, as you know, started to implement some telemedicine as well to try to help with some of those travel challenges.
Yeah, I think that's been really helpful for families. So, do you want to highlight other ways that the team kind of supports or has options for patients after surgery?
Well, all the providers in the team, are very passionate about it. We certainly love to see the patients and love to see them back. And Nancy Thompson, our surgical coordinator, talks to them on a regular basis and supports them. That being said, we also provide a support group for the patients, as there are lots of adolescent patients now that are reaching out to each other and for support before surgery and after as well. We're looking forward to seeing that grow as well over time.
Yeah. What other things would you want to highlight about weight loss surgery for our Facebook Live audience?
Well, I think that really, because so much has changed in the field over the last 10 years, particularly the last 5 years, last couple of years, lots and lots of great data to demonstrate that it really should be considered in these patients. What has been traditionally used in terms of really encouraging kids to just get more exercise and eat less, it just does not work in patients that are severely obese. And so hopefully family members and providers will start to realize that this is an important treatment for these patients that really are debilitated often by their obesity and the medical problems associated with it. And so we certainly hope to be a resource for parents, patients, and the community on this subject, and really look forward to working with families in the future.
Yeah. Well, thanks for taking time to sort of go over more, and thanks for joining in to our Facebook Live session. As a reminder, please leave your questions below, and we'll help answer them for you. If you're interested more about kind of the comprehensive services that we offer for youth of all ages at the Healthy Lifestyle Center at Children's Hospital of Richmond, please go to our website. We'll also attach some references, including the AAP policy statement for folks that would be interested in looking more about that. So have a great afternoon. Thanks again for your interest.
Thank you.